So when people come in with complex problems, the key really is to do a very, very thorough examination. To give you an idea, typically a new patient in our office, we spend 40 to 50 minutes with them. Most patients have never had an experience where they have a 40-minute examination with a doctor, but we have to really collect a lot of data and we have to understand what's important for that patient. So typically a new patient comes in and I talk with them in this room, my consultation room, and I want to understand why they called me, what it is that they want to get out of their dental encounter, what problems they want to fix. A problem can be important to me, but I'm not the one with the problem. I want to be sure to address what's important to them. And that can only come with time and talking with the patient. I also want to understand many times what's kept them away from dentistry for a long time. Do they have any particular concerns? Do they have bad experiences in the past? After that's done, I'll review their medical history very carefully. Many times there are things in someone's medical history that will affect their dental situation. So we want to know about that before we start to maximize the chance of having a successful outcome. And then once that's done, we examine the patient and do a very detailed examination of the gums, a very detailed examination of the teeth. We do an oral cancer exam, we check the jaw joint, we do an aesthetic analysis if they have aesthetic concerns. And then after that's done, I'll discuss with them what radiographs I feel are necessary. Sometimes people need no x-rays, they come in with x-rays from their dentist and they're fine. Sometimes people need dental x-rays, sometimes they need a 3D dentist scan called a CAT scan. Any x-rays that we take are digital, so the days of film and dipping film in the tank is long since gone. Digital radiography is fast, it's accurate, and having the 3D cone beam scanner to take dentist scans allows us to evaluate people's bone for dental implants. So they don't have to leave the office, they can have the scan done right here, and really instantly we can know if they're a candidate for that sort of treatment. So unraveling a complex problem starts with really a detailed examination. And then most times people have more than one option. So frequently people will say, well, just tell me what I need. But it sort of doesn't work that way. What somebody needs is a function of what they want. It's almost like if you want to buy a car or go get a new apartment. If you go to the car dealership and say, well, tell me what I need, they have to know more about you and they have to know what you want. Do you want something sporty? Do you need a family car? Do you need a gas efficient car? And there are many times, many ways to get to an endpoint of good health and good aesthetics with a patient. So knowing what's important to them helps me find a solution that works for them. Is it important for somebody to have something that doesn't come in and out of their mouth, or are they comfortable with something that's removable in place? How important is it for them to enhance their smile or change their smile? What does their smile look like? How many teeth do they show? What are their budgetary constraints? Obviously, we have to find a solution that fits within somebody's budget. So we try to talk to people about that as well and understand what do they want to accomplish, what are their means, what's their budget to accomplish that, and we do our best to find a solution that fits within those parameters. I mean, my hope and expectation is that every patient will leave thrilled. We want to again, I want to do for the patient what they want to have done, not what I want to have done. So that's why I really have to talk with them and understand what it is that they want, what's important to them. And I hope that at the end of treatment, they'll say, I was treated great. I mean, if you look at our reviews, one thing I'm really proud about is people say we pay a lot of attention to them. They're never left alone. They never felt like they were a number. And I think we really spend a lot of time trying to understand what someone's concerns are and sort of what makes them tick, what they need to be comfortable. I want them to leave having had great treatment. Treatment should be comfortable. We pay a lot of attention to making the procedures themselves comfortable, whether that's an adequate explanation, topical anesthetic, proper Novocaine, sedation if they want it. I want them to leave saying that was really very, very comfortable. I thought it was going to be horrible, it was comfortable. I want them to leave knowing that we paid attention to how they were after the procedure. They had adequate pain medication. They knew how to reach me if they needed me. And ultimately, I want them to be happy with the treatment they got, whether that's treating their gum disease so that they can keep their teeth, whether it's replacing one tooth with a dental implant so they can chew, replacing a front tooth or missing teeth so they can smile again, or replacing a whole arch of teeth where people had no teeth or really poor looking teeth. Two things, communication and trust. And you can only build trust with communication. I personally could never practice the model where you sit down with somebody and start treating them without ever talking to them and sort of getting to know them. Everybody's, I would say there's sort of a body attached to the mouth, and you sort of have to know what someone's been through in the past, what their concerns are. I have to know what's important to them, and I have to understand sort of what's going on with them. Only through having that conversation can the patient be comfortable that I'm the right doctor for them, that I understand them, and I'm going to try and address their needs. And by the same token, we like patients who sort of respect and appreciate us. People that keep their appointments, people that value what we do for them. And I think that's a mutual thing. I think that we try very hard to run on time, to see patients on time, to respect their time. And our patients really rise to the occasion. They come on time, they keep their appointments. And in the end, I think they're really very, very appreciative of what we do for them. And we're really appreciative and honored that they chose us to help them.